Welcome students. Today we are going to see about Buccal drug delivery system. First of all, what is NDDS? Novel drug delivery system are the system of man searches for new method of entry of drug into the body in order to show its activity in the body. The new drug delivery system has been developed and developing are mucoadhesive drug delivery system, drug patches, transdermal patches, etc. Buccal drug delivery system. The buccal mucosa lines the inner cheek and the buccal formulations are placed in the mouth between the upper gums, cheeks and to treat the local and systemic conditions. It is richly vascularized and more accessible for administration and removal of dosage forms. Additionally, buccal drug delivery system have high patient acceptability compared to other oral routes of drug administration. So, buccal drug delivery system means it lines the mucosa on the inner cheek and the drug is given in the form of buccal strips or tablets in the mucosal region. Extensive first-pass metabolism of the drug degradation in harsh gastrointestinal environment can be administration to buccal route. First-pass metabolisms can be prevented by administering the drug in the buccal route. Drug absorption through the buccal mucosa is mainly by passive diffusion into the lipoidal membrane. After absorption, the drug is transported through facial vein and then drains into the general circulation via genual veins by passing the liver and thereby sparing the drug from first-pass metabolism. Buccal routes provides one of the potential route of typical large hydrophilic and unstable proteins, oligonucleotides and polysaccharins as well as the conventional small drug molecules. So, drug absorption through buccal mucosa is only by passive diffusion. After absorption, drug is transported through facial vein, which drains into the genular vein by passing the liver and then sparing of drugs by first-pass metabolism. Advantages: ease of administration, easy for administration of the drug. Termination of therapy is easy. The using of therapy is easy, permits localization of drug to the oral cavity prolonged period of time. The action must be in prolonged period of time. Can be administered to unconscious patient. Unconscious patients also we can use this buccal drug delivery system. Offers the excellent route and systematic level of drug high first-pass metabolism. It shows very high first-pass metabolism and it has greater bioavailability. A significant reduction in dosage can be achieved by reducing the dose-related side effects. Drugs which are unstable in acidic environment are destroyed by enzymatic or alkaline environment of intestines can be administered by this route. Drugs which show poor bioavailability via oral route can be administered conveniently. The presence of saliva ensures relatively large amount of water for drug dissolution, unlike in the case of rectal and transdermal routes. Systematic absorption is rapid. This route provides an alternative for the administration of various hormones, narcotics, analgesics, steroids, enzymes, cardiovascular agents, etc. Therefore, the buccal mucosa is highly perfused in blood vessels, offers greater permeability to the skin. So, the drugs which are unstable in nature also can be easily used by this buccal route, and with drugs showing poor bioavailability can be easily convenient by oral route, and it does not require a large amount of water because the presence of saliva itself dissolves the route, unlike in case of rectal and transdermal. Systemic absorption is very rapid. In alternative cases, it is used for hormones, narcotics, analgesics, steroids, enzymes, and it is highly perfused and greater permeability. Easily, it is great permeability in the skin. Disadvantages: drugs which are irritate the oral mucocavity have bitter and unpleasant taste, odor, and administration. So, some drugs which are irritate the oral mucosa, it will irritate our mouth because of their unpleasant taste, odor, and can be administered by this route. Drugs which are unstable at buccal pH cannot be administered. So, unstable pH drugs cannot be used by this route. Only drugs with small requirements can be administered. Drug with larger dose cannot be given by this route. Drugs may be swallowed with saline and lost the advantages of drug. Sometimes we may swallow the drug with the saliva, so it cannot give any bioavailability. Only those drugs which are absorbed by passive patients can be administered by this route. So active decision drugs cannot be administered by this route. Eating and drinking may become restricted. Limitations. The mucus is constantly removed from the epithelial surface, which will be eventually washed out due to the site of applications. When it is applied on the mucus layer, when we mouthwash, it will be washed. Mucus churn the rate of different person from the person, so fabrication of dosage form is difficult. Then the adhesion rate of dosage form in the body may not be as proposed specification due to disease state, different physiological factors, etc. The good adhesive polymers that will fulfill all the requirements are less. Mucoadhesive polymers are polyelectrolytes. Slight variation in pH, charge of mucus changes at mucoadhesion property of polymer significantly. This type of drug delivery system is not suitable for the drugs that cause irritation, tissue irritation. The oral cavity can be used for local and systematic therapies. Example, local therapy would be used in the treatment of oral infections, dental caries, mouth ulcers, somatosis, gingivitis, etc. The buccal roots of the particular interest with regard to the specific systematic delivery system of a small molecules and are subjected to first-pass metabolism. Drug delivery pathways. Two pathways are transcellular route and paracellular route. Environment of buccal mucosa. The cells of oral epithelia is surrounded by intracellular ground substance called mucus. So, the oral cavity is marked by the presence of saliva produced by the salivary glands. Mucus, which is secreted in the major mammary salivary glands, are the part of saliva. Role of saliva. Continuous mineralization, demineralization of tooth enamel, protective fluid for all tissues of the oral cavity, to hydrate oral mucosal dosage forms. Role of mucus. Bioadhesion, mucoadhesive drug delivery system made up of proteins and carbohydrates, cell-cell adhesion, lubrication. Buccal drug delivery and mucoadhesion. Mucoadhesion is the device is a key element. Is a key element. The term mucoadhesive is commonly used for materials to bind with the mucin layer. So, what is meant by mucoadhesive means it is a common term which used to bind the mucin layer of the biological membrane. And active systematic delivery of drug includes tablet, patches, tapes, films, semi-solids and powders. Design of buccal forms. First one, matrix type. Matrix type means it will be designed in the configurations containing drug adhesive and additives mixed together in a matrix form. Bidirectional patches release drug both in mucosa and in mouth. Next, reservoir type. This batch buccal patches designed in reservoir system consist of cavity for drug and additives separate from additives. Impermeable backing is applied to control the direction of drug delivery to reduce patches deformation and disintegration while in the mouth to prevent drug loss. Buccal mucoadhesive dosage forms. Three types of buccal mucoadhesive dosage forms. Type 1, single layer device with multi-directional release. Type a specific drug dose loss due to the swallowing. Type 2 impermeable backing layer is superimposed. Type preventing drug loss to the oral cavity. Type 3 unidirectional release device. Drug loss of minimal achieved by coating every face except contact face. Buccal formulations. Buccal tablets. Buccal tablets are small, flat, oval-shaped dosage forms. Unlike conventional tablets, buccal mucoadhesive tablets allow for drinking and speaking without major discomfort. They often adhere to the mucosa and are retained in position until dissolution or release is incomplete. So these tablets can be applied in different sites in the oral cavity, including palate, the mucosal lining, cheeks, as well as between the lip and gum. These tablets are also usually prepared by direction compression, but wet granulation techniques and also used. Multi-layered tablet can be prepared by sequentially adding compression to the ingredients layer by layer. Some newer approaches uses tablets that melt in body temperature. Example, nitroglycerin biadhesive tablets for the treatment of angina pectoris and sumatriptan succinate buccal adhesive tablet, which is effective in the acute treatment of migraine and cluster headaches. Second one, buccal patches or films. Buccal patches or films are laminate consisting of an impermeable backing layer, a drug containing reservoir layer from which drug is released in controlled manner, and bioadhesive surface of the mucosal attachment. Two methods used to prepare adhesive patches include solvent casting, direct milling. In solvent casting method, the immediate sheet to form the patches are punched prepared by casting of the solution of the drug and polymer on the backing layer sheet and subsequently allowing the solvents to evaporate. In the direct milling method, formulation constituents are homogeneously mixed and compressed to desired thickness, and patches of predetermined size and shape are then flat out punched out. The impermeable backing layer may also apply to control the direction of drug release, prevent drug loss, and minimize deformation and disintegration of device during the application period. Example, isosorbate dinitrate in the form of unidirectional peroxide buccal film are developed and characterized for improving bioavailability. Buccal films of salbutamol sulfate and tetrabutane sulfate for the treatment of asthma, buccoadhesive film for clindamycin used for pyorrhea treatment. Next one, buccal gels or ointments. Buccal gels or ointments such as semi-solid dosage forms have the advantages of easy dispersion throughout the oral mucosa has been overcome by using bioadhesive formulations. Certain bioadhesive polymers undergo a phase change form of the liquid to semi-solid. This change enhances the viscosity which result in sustained and controlled release of drugs. Evaluation of buccal tablets. Parameters of evaluation: determination of residence time, permeation studies, swelling studies, release rate studies, toxicity and irritation studies, bioadhesion measurement, folding insurance, content uniformity, surface pH, 1% agar solution and for 2 hours and equilibrium for 1 minute. Products used. Oral bioadhesive formulation, Scorlan, hydrocortisone succinate, Bonchella, hypomelos, Dactrin, Miconazole, Corsadin, Chlorohexadine, Buccal mucosa formulation, Buccasin, nausea, vomiting, vertigo, sustained angina. Thank you.